Happy Halloween, everyone. As you can tell, it's Halloween and Isabel's all dressed up today. But what we're going to do today is we're going to talk about Kybella. Now, you've probably seen the ads on TV or maybe you've heard them on the radio or seen them in the magazines. Kybella is a newer medication that we're using to break apart or dissolve fat, particularly in this area. So we use it to treat the double chin. And what it does, it works by breaking apart fat. The real name of Kybella, or the generic name I should say, is deoxycholic acid. That's actually a substance that's secreted by our gallbladder to help break up if we eat, say, a fatty meal. So that same exact deoxycholic acid is what we inject and breaks up the fat under the chin. So we're going to demonstrate that today. Carrie's going to be assisting me. And you're going to see it's a very simple procedure with, Isabel has no numbing cream or anything. It's a very, very tiny needle, which I'll show you as soon as I get my gloves on here. Alright. So you can see the needle's really fine. So Isabel's barely going to feel any of this. So you can see we mapped out our procedure. Each of these little dots is places where I'm going to inject this Kybella or deoxycholic acid, and it's going to break up the fat and it's going to reduce the size of the fat or the double chin in that area. So here we go. So you can see I'm pinching up the skin, and then I inject some medication into the area of the dot. And Isabel's doing great. And Carrie's going to hand me another syringe here in a second. There we go. So you can see how quick this is. We'll be done in just a matter of minutes. And then Isabel can go about her normal day. Now, patients can certainly expect to get some swelling afterwards. And as you can imagine, anytime you poke the skin with a tiny needle, there's going to be a risk of some bruising as well. But a lot of times we treat these patients and you'll see no bruising at all. Can I get a 4x4, please? Thanks, Carrie. So Isabel, are you feeling any significant discomfort at this time?
No, not at all.
It's very easy for the patient. I'll turn this way for me. Here we go.
Do some patients require more than one treatment?
That is true. Some patients will require anywhere from, I'd say, a minimum of 1 treatment up to maybe 4 treatments, depending on how extensive the fat is under the neck area. But the nice thing is it's a procedure that you can do from a patient perspective and go right back to work. There's no really significant downtime besides, if you consider a little bit of swelling and a small bruise downtime, but most patients don't. Almost done. Turn more. Okay, here we go. We're finishing up right now. Isabel's doing great. So be sure to follow up with us in the next few to several weeks, and we'll post pictures of how Isabel's doing. So that's Kybella. Happy Halloween.